So if you see this now, the indifferent that I have moved to a little bit down to the wrist. Why? Because I don't want to stimulate the other muscles, and I want to stimulate only the intended muscle, which is my lumbrical. And the previous video that where you saw is, you could see that her long flexor started to work. Now you can see that I am now stimulating only the lumbricals. Exactly, if you see the difference, that I dragged it back over that line, and you can see that the IPs are flexing and the MCPs are flexing and the IPs are extending. So I am exactly at the only I am stimulating the lumbricals of the medial portion. If I want, I can stimulate even the lateral portion, which we do it in median now actually, rather than stimulating this, I can stimulate all the muscles at one, all the lumbricals at one go. That if I come here at the mid of the palm, the center portion of the palm, if I stimulate, you can see that all lumbricals, this is lumbricals in group, where I can stimulate. Whereas if I want to stimulate only the medial portion, then I can stimulate here, where I will stimulating only the medial portion of the lumbricals. In ulnar now, I generally stimulate only we need to stimulate only the medial portion. That's why I showed you this. The next point of this is the interosseous. Interosseous, textbook says that dorsal and palmar interossei can be stimulated at one thing. That is, interosseous is actually in between the two metacarpals. In a ulnar nerve lesion where you have a nerve injury, you can actually see the guttering of finger spaces. That in between these two metacarpals, you can see a complete guttering. That where you can see where you will be stimulating. So I'll be stimulating in between these 2 points, and you can see, and I'll be stimulating all the others if I want. Yeah, you can see it is predominantly, it works. Okay, you can see that how I am actually stimulating. Yeah, still what I am missing is the first dorsal interosseous. I'll be coming here and I'll be stimulating. This is the second metacarpal, and the shaft mid of that, if I am going to put my stimulator and I am going to stimulate, and I can actually make, this is slightly an issue. Why? Because the adductor pollicis is here is the adductor pollicis, and here is the first dorsal interosseous. Though I say it is a pen electrode, but still the size of this electrode is too large that it covers the entire web space of the thumb. So I'll be stimulating. Rather, it is better to use sharp electrodes, sharp ones, where I can have the better stimulation of this. But the disadvantage of such electrodes are the density of the current is going to be so high. Sometimes my patient may not tolerate such high densities. Even if the intensity is small, but the density is so high, it will be painful for my patient. They may not tolerate. So if I want to show, can you relax your hand, please? Just relax. Relax. Put it in adduction so that when I get an abduction, I can show. Yeah, you can see now. No, don't try to do it. Just relax. Okay, relax. Leave it. Now you can see that it is actually what happened is I purely produce the. Okay, I purely produce only the. Just relax. Whenever the current comes, you can feel the muscle is actually, you can palpate the muscle here. This is the muscle where you are going to palpate. The first dorsal interosseous is here, and you can feel. Okay, so that is. But for the adductor, you have to go a little bit down and go towards the thumb metacarpal, where you will have, and in the web space, when you make a web space, can you make type 1? Yeah, approximate. You can see the bulk here. This bulk is actually, this portion of the bulk is your first dorsal interosseous, and this portion of the bulk is your adductor pollicis. So I'll be actually stimulating here. This is a normal, so I can show you the bulk, but in a patient, obviously, if it is wasted, you have to use your basic anatomy knowledge that where the muscle is originating and inserting and where I expect the bulk. Yeah, you can see now this is. So that's how I differentiate. Though this is my adductor, and if I come here, then this is my first dorsal interosseous of that. So this is abducting. So that's how we differentiate between the motor points. So though the bulk may be at the same place in the web space, I can still make the difference of adductor pollicis is here and abductor here. So this is, we saw all the interosseous here actually. If you want only the palmar interosseous separate, that can be also done, where what you are going to do is you will be actually stimulating here, okay, these portions where you can get the only the palmar interosseous getting stimulated. Though this is not in the textbook, but in clinical practice we follow this, or at least I follow this. You can see it is getting adducted. And remember, the middle finger doesn't have a palmar adduction, so I will be stimulating only the other three. You can see now the little finger is getting adducted. You can see that the ring finger is now getting adducted, and now here you can see that the index finger is getting adducted. So that if you want to stimulate only the thing, or if you want to stimulate all at one go, then what you can do is you can stimulate over here, which I showed you earlier. So with this, that ulna now gets over. Just I will summarize. I will actually put my indifferent over here. That is over, okay, just below, behind the medial epicondylar groove, where the ulnar nerve is actually superficial. Then this is my bulk of my flexor carpi ulnaris, medial side. So I'll be stimulating here the flexor carpi ulnaris. That's the motor point that I'll be stimulating. Now the next portion is the entire flexor carpi ulnaris is up to this level, the bulk. So where the bulk ends, there the flexor digitorum profundus medial part is a deep muscle, so that will emerge out here. So I'll be stimulating here for my flexor digitorum profundus medial portion, and I can see in the flexor carpi ulnaris, I can palpate it over the pisiform to see the muscle that is actually contracting. And for my flexor digitorum profundus, I can see my distal IP specifically. Though the entire finger will go for a flexion, I can see that the distal IP is also working. So I can confirm with that. Then the next part of this is going to be the hypothenas. Hypothena, my abductor digiti minimi is here. My flexor digiti minimi and opponent's digiti minimi are here. How to differentiate? Flexor digiti minimi will bend only the MCP, whereas my opponents, if it is working along with that, it will make the fifth metacarpal to rise from the surface. So this is about this. Then we go with the lumbricals. The medial portion of the lumbrical can be stimulated over here, this line, crease. Or if I want, I can go in the mid of the palm where I can stimulate all at one go. Okay, where I can do it. Okay, so these are the points that where I can do it. And interosseous over here, that is in between the metacarpals. But the thumb, that is adductor pollicis, and the first dorsal interosseous are close to each other. So what I can do is I can place it over here to get the adductor pollicis, and I come here, then I can get the first dorsal interosseous. Even within that, I can actually differentiate. So this is all about the ulnar nerve stimulation.